Okay, good evening everyone and welcome to tonight's Facebook Live. I'm hoping you can all hear me. Sorry about the technical fault. I don't know what it was. It could be the storms. Who knows? But I know we're definitely out of the Mercury retrograde for sure. So let's just wait for a few people to hop on and let us know if you can actually hear and see us. And we'll just wait a few minutes. People should start popping up in a minute now. Or not. All right, so what we're going to...
For viewers, yeah.
Okay, here we go. We've got a few people who are joining us. Thank you so much. In the comments, if you don't mind, just let us know if you can hear us. That'll be great. And if you can't, then we have another problem. All right, just type in the chat box. Yes, we can hear you. Or no, we can't. Here we go. Oh, yay! Okay. Hello, Sammy. How are you? All right. So here we go. Take two. It's probably the Melbourne Storms. Who knows? All right. So here we go. Let me bring up that intro again because... all right. So... Take two. So tonight's a very special episode because for the very first time, I am joined live by Professor Christoph Hagemeyer. And many of you in the industry may not know Christoph yet. So I really want to introduce him properly. Professor Christoph Hagemeyer is the head of nanobiotechnology laboratory at the School of Translational Medicine at Monash, the director of Monash Biomedical Imaging, the Monash University Node Director of the Australian National Imaging Faculty and Facility. And the Victorian Biomedical Imaging Capability, as well as the Principal Investigator of the Monash Helmholtz Laboratory for Radio Immunotheranostics. Originally trained in chemistry in Germany, Christoph completed his PhD in biochemistry at the University of Freiburg. His research career spans molecular imaging, recombinant antibody engineering, nanotechnology, vascular biology, and targeted drug delivery. He has published over 120, that's right, 120 peer-reviewed papers in leading international journals. He has more than 7,200 citations and has secured over $30 million in competitive research funding. Congratulations.
Thank you. Thank you.
Wow. In simple terms, Christoph works at the molecular and cellular level of how tissues communicate, repair, and regenerate. And tonight, we're bridging that world of biomedical research with clinical aesthetics. Christoph, welcome.
Thank you very much, Nancy, for inviting me along and having me here. I'm very excited about really exploring the wonderful world of exosomes and how exosomes are used in skincare and in aesthetics. So I'm a newbie to the industry, and my first exposure to exosomes in aesthetics was at the Expo in Sydney last year, and I just went along for the ride and went to a few of the talks about exosomes, and I thought, there's a lot of claims out there. There's a lot of hype around exosomes. And I was really surprised how prominent exosomes are in this field, because we are working in the medical space a lot with exosomes in my laboratory. So it's interesting to compare the two fields. And I thought it's important to really put some science behind the claims which are out there and really drill down on what's true and what's hype.
Yeah, and I remember you coming away from Beauty Expo last year saying, I don't know if everyone's sort of like being really transparent and clear. And And that's like, I suppose, our conversation sparked many other conversations following along about,
Exactly.
our industry and transparency and just being real, right? So we're here today to bust some myths and also work out what is hype and what's science, really. Yeah.
Yeah.
So let's have a quick look. We know that, when we first spoke about exosomes and how you told me that they actually came about, it really fascinated me. Can you tell me a little bit more about that? First, where did exosomes originate? When did they come about? And, how do we extract them these days?
So exosomes were first discovered in the 1980s when we studied immature red blood cells. And it was observed that their little vesicles are shedding from these immature red blood cells. And initially it was thought that they are waste disposal systems of the cells. And then when the methods developed to characterize these very, very, very tiny particles, we're talking about 30 to 150 nanometers, so they're really, really small. They found that they contain lipids and proteins and nucleic acids, so RNA, and they thought it can't be all waste. It must be has some function. So it was then explored that they're actually cellular communicators. So they're little vesicles which communicate with other cells and can travel all the way through the body, from the lung to the heart, from the brain to the liver, and deliver a message across the body. And that was then really established the field of exosomes, which we are now talking about. So from the waste disposal concept, it really was a paradigm shift towards that they're cell-cell communicators.
Right. And so in terms of biological terms, what exactly are they and what's their role in the human body?
So it's very important to understand that they're not cells. So they can't replicate, they can't modify DNA. So they're basically just lipid vesicles which contain a certain amount of lipids, proteins, RNA, and signaling molecules. And the cell deliberately packaged them inside the cell into larger vesicles which contain exosomes, and then they're brought to the cell membrane, and then this cell membrane goes out into the outside of the cell, and these exosomes are then released to the outside of the cell. And then they travel in the blood or in the tissue to other cells and communicate their information with other areas of the body.
Yeah, great. Love that. And so are they actually regenerative? I can never say that word. Are they regenerative? Do they regenerate themselves, or are they better described as, like you said, like messages, and they help with messaging?
Exactly. They're not drugs per se, so they don't really work as a therapy. They're more stimulating regeneration, so they encourage the other cells to regenerate or to increase inflammation, reduce inflammation, to change the cellular cycle, to do certain things. So they're basically a messenger and not the drug itself.
Okay, so they essentially, they don't build the tissue per se, but they just signal other cells to respond.
Correct.
So
Correct.
Nice and simple.
Yeah.
Love that. Okay, so from medicine to aesthetics, it's a really big shift. But actually, is it really? I don't think it is, because what you do in the lab and in medicine can kind of be translated into the largest organ, correct?
Yeah, so I think exosomes have been studied in medicine for a long time, since they were discovered. And in the different areas, they have different impacts. So the biggest impact is probably in oncology, so in cancer research. So exosomes are now isolated routinely from blood of humans. And then the exosome signature in the blood can tell you if there's, for example, a certain cancer present or not, which is we call that a liquid biopsy. So instead of sticking a needle into an organ to take a biopsy, you take the blood and the liquid and analyze this, and you can understand what's going on in the body. So in oncology, there's a big impact. Neurology, neuroscience also it has been shown that they cross the blood-brain barrier, so they can influence the brain, they can communicate with the brain. So that's an interesting area. There was a lot of hype in heart disease and in regenerative medicine. So if you have a heart attack, your heart muscle will weaken. So you want to have a signal to strengthen your heart muscle after an infarct. And people derived stem cell derived exosomes and modified them and injected them into the heart or into the body. But the clinical data is really, really mixed. So there's not a lot of evidence that it actually does something to the heart.
Yeah.
Inflammation is important, of course, and that's important for skin care. So it has definitely a role in dampening inflammation, and that's where it's really relevant in skin care. And aesthetics, I think there is some evidence that it does something, but it's a very, very young field. And exosomes are, as we know, talked about in aesthetics quite a lot.
Yeah. So going back to translational medicine, what and where is the strongest evidence currently emerging for exosome application?
It's probably in oncology and neurology, I think.
Like you said.
And inflammation, that's an emerging field, that it can really dampen inflammation if there's overshooting inflammation, which can be quite dangerous. So sepsis, for example, which is the overreaction of the body to a bacterial infection, for example, then exosomes have been shown to help.
Right. And speaking of inflammation, in aesthetics, we actually create this controlled injury, whether it's through laser, microneedling, plasma fibroblasting, RF microneedling, like I spoke about last week, and so forth. And there's so many different modalities, of course. But from a biological perspective, how might exosomes influence inflammation and that inflammatory pathway and wound healing?
So as I said, it has been shown that they play a role in wound healing and in dampening inflammation. That's probably the strongest evidence in aesthetics as well, that it can reduce this inflammation. What's important to note is that more exosomes or giving more is not always better. So they're modulators of inflammation. They're not something which treats inflammation directly or reduces inflammation directly. So if you give too much exosomes, I think, or too frequently, it could be detrimental to what you want to achieve and the outcome.
Right.
So that's important to remember.
Okay. And what about timing? So in terms of, when we're doing a treatment in the clinic, do we apply them straight away or do we apply them later? Like, is timing important at all?
Timing is important. You want to go in early. Prevention is always better than treating. So I think after a treatment, you want to get in early to reduce this overshooting initial inflammation. But then you don't want to go too frequently because you want the body to adapt to the signaling you just gave the cells. And the cells need some time to remodel and to change their ways and to change their metabolism. And then maybe after a week or so, you give a second dose. It depends on the individual patients and the individual people who get the treatment. Every skin is different. Skin reacts differently to treatments. So I think there's a judgment needed when there's a second dose required.
Right. And I think it also then depends on how much inflammation and what type of device created the inflammation too, I guess.
Yeah, absolutely. Yeah. If it's like a severe injury or it's a superficial injury, that depends also on how much the skin barrier is impacted.
Right. And so let's say, for example, I did an erbium laser on a friend yesterday, and I put some exosomes straight away onto her skin. Would it be advisable for her to keep applying the exosomes? Can she put it morning and night, or like what do we do there? Like, what do we recommend to clients to do?
I would definitely give it at least a few days to see if there's and that probably needs to be empirically tested on either the manufacturer and show some evidence that after one application you see a reduction in inflammation after 2 or 3 days, and then you apply a second round. So manufacturers will usually give some guidance what the dosage and what the frequency is, but it needs to be then tailored to the individual patient.
All right. Okay. And what about in terms of? Or we'll probably come to like delivery later on, won't we?
Yeah.
Okay. So we'll first talk about plant exosome versus human exosome. Tell me a little bit more about that. So there's so much more discussion about, whether one is better than the other. But You tell me, what do you think?
So it's a very controversial topic. So I think the issue with mammalian-derived exosomes is that there are ethical implications, and there's also the source material is limited. Yeah. So if you look at human cells or human tissue, it's not as abundant as cellular raw material. So I think that's one of the advantages of plant-derived exosomes, is that you have pretty much unlimited amount of starting material. And then exosomes in plants are generated a bit differently, so they're not really derived by endosomal assembly. It's a bit of a different pathways intercellularly. But if you look at the size and what they contain, it's pretty similar between plant and mammalian exosomes. So there are certain lipid species, certain RNA species, cholesterol, for example, heat shock proteins, which are similar between mammalian and plant exosomes. So there are a lot of, they're not identical, but there are a lot of similar ingredients.
Okay. All right. Are there any other differences?
I think some molecules which are not present in plants won't be delivered. So I think there are some unique molecules which only human exosomes can provide. But is that really important to have a certain outcome? That's, I think, still up for debate and up for active research.
Right. And what about the interaction with human cells? Will they interact in the same way, or will they be slightly different? I think I'm asking this, and I'm probably asking for everyone else, because there is a little bit of hype around, do we go, human or do we go plant? So let's nut this sort of dilemma out.
I think from an ethical point of view, from a safety point of view, plant exosomes are likely the better choice, because you don't have issues with that you get potential disease or infections, which you can get from human tissue. And the plants, as I said, you can scale up, you get larger amounts. It's also cost of goods requirements. So I think the plant exosomes are probably more cost effective and more affordable than the mammalian derived exosomes. And if they provide the same outcome, I think we would definitely go with plant exosomes. But they're not identical. But there's no reason why the ingredients in plant exosomes can't interact with human cells, because a lot of the molecules in the plant kingdom or in the animal kingdom are identical. Yeah, there's a lot of biological identical systems, and the lipids and the RNAs and the proteins are pretty much conserved through evolution.
Because, I mean, look, honestly, I thought in the beginning, when I started researching exosomes, that your human exosomes are going to be better and they're going to be more efficacious. But as I learnt more and more, that really isn't true, actually. And with plant, we can be a little bit more, if we want a particular outcome. And plants, is it right that we can kind of focus on that with the different types of plants, or not really?
Exactly. I think we have a much wider variety of potential source materials. Yeah, and if you look at medicine in general, a lot of antibiotics, a lot of therapies which we have now in clinical use come from plants. Yeah, so antibiotics and certain other drugs, and they're really specialized researchers who go, especially in Australia, who go out in the bush, go out in the rainforest, go out in the desert, and find plants which have not been discovered before. Their species still get discovered in Australia, and we have no idea what these plants contain, what the exosomes contain. And I think there's an enormous potential and a repertoire of novel exosomes and novel ingredients in exosomes where we have no idea what they can actually have for benefits for skincare or medicine in general.
Yeah. Okay. All right. So there's a bit of an overlap, and I think we just need to be careful with, what we're believing. Is that right? And what we're told. So I think we need to question that.
Exactly. I think to say that plant exosomes are useless and not doing anything for humans is completely not correct.
Okay. And so when it comes to your pros and cons, is there, and we've mentioned a couple about, like the cleanliness or the sterility and not passing on certain diseases, but are there other pros and cons of plant exosomes versus your mammalian derived?
I think you mentioned most of them. I think
Okay.
cost of goods, basically the plentiness of the source material, maybe ease of production as well, because
Yeah.
you just get the plant, you immediately crush it, you extract your exosomes, and then you purify them. In the mammalian system, you need rather expensive equipment to culture cells, and then you need to process the supernatant of the cells, so where the cells are growing in, then because that's where the exosomes are harvested from.
Okay, we mentioned all that before.
Yeah.
So that was it really. All right, well, what about in clinic when, we see exosomes applied topically? They're infused post-needling or, like I said, RF microneedling or erbium laser or whatever it might be. And sometimes they're actually injected. Can exosomes penetrate intact skin, or is barrier disruption required for meaningful cellular interaction?
So as we know, intact skin is a major barrier. The skin is designed to not let pathogens or anything which is larger into the cell or into the body. Exosomes, as I said, are around 30 to 150 nanometers, which is far beyond the size what can penetrate naturally through the skin, unless the barrier is in some way compromised or opened.
Right.
And I think if you have exosomes which are just topically applied onto skin without any mechanical or chemical way to increase penetration, it will not do a lot.
Yeah.
Probably nothing.
Okay. So, from what and, we've been discussing over the many months, like different modalities, from what what do you think are great ways to actually get those exosomes, working optimally in the skin rather than on the skin?
So mechanical ways to penetrate is a good way. So microneedling and ultrasound, sonication, electroporation are all very good ways to open the skin barrier, to potentially in situ, so on the skin, rupture exosomes so they can release their payload, and then the payload can infiltrate into the skin. You don't always need to have the full exosome going into the skin. Yeah, it's really about what's in the exosomes. If that's then penetrating into the skin and delivering the signal to the skin cells, that's probably enough to change this cellular reorganization.
Right. So let's do one modality at a time. So you mentioned first of all microneedling. With microneedling, it's a mechanical trauma. We're creating this little channel, I guess, if you will, with the insertion of these microneedles. And with these microneedles, do we actually have to penetrate the skin very deeply? Like how deep? Are we going deep or superficial? 0.5 mil, or do we need to go really deep for it to work effectively?
I think you just have to penetrate so far that they can go through the main barrier, and if they're across this barrier, exosomes have the ability, because they have an autologous or internal mechanism to find their target. Yeah, so they have receptors on the surface as well. They not only have payload, they have something on the surface of the exosomes which tells them where to go. So they can once they have crossed a certain barrier, they find their way to where they belong and where they go.
Okay.
Need to go by themselves. So you don't have to be overly aggressive in your penetration.
Okay. And so I suppose this brings me then to a clinical perspective. I usually teach that we needle until I get pinpoint bleeding or petechiae for collagen induction. But if you're needling to allow that that barrier, not the barrier disruption, but to allow the exosome just to overcome that barrier, we don't actually need to penetrate that deeply then. So, whether it's a 0.5 mil or even less, really, is more than enough.
Yeah, it's a different mechanism. Yeah, I think with the deep stimulation, you really want to have a deeper injury, but for penetration, you only need to create holes to a certain depth so that the exosomes can penetrate into the skin.
Amazing. Okay, so two different things. The next modality you mentioned was it ultrasound?
Ultrasound or
yeah,
electroporation. Ultrasound, of course, will likely, depending on the frequency, destroy the exosomes and release the payload, which is a way to bring the small molecules, because the small molecules which are inside the exosomes are usually small enough to then go through the barrier. It's just the exosomes itself, because they're so large, can't go through the barrier, but the payload can.
okay. So just so people understand, and I can understand, what's payload?
A payload is that what's inside
Okay.
the exosome. So everything which is inside the exosome, that's not only proteins, it's RNA, it's lipids, it's small molecules.
Right.
So that's usually set as the one, because you don't say each individual component. It's a mixture.
Right. And the outside, the encapsulation, we want to break that. And so from my understanding, so correct me if I'm wrong. So with ultrasound, we're actually breaking down the outside, right, the encapsulation, to allow the insides then to do what they're supposed to do.
It depends on the frequency. You don't need to destroy the exosomes for them to be efficient, because it's a lipid membrane, and the lipid membrane of the exosomes can fuse with the target cell. Yeah, so that's usually how exosomes deliver their signal to the cells they are communicating with.
Right.
Yeah, so they get from one cell, they get out of the cell, they travel, and then they go to another cell and they fuse with the target cell.
Okay. And then we've got electroporation, where we're creating, I suppose, cell permeability. So again,
that's exactly, so if it's all about lipid membranes, yeah? So you have cells have lipid membranes, exosomes have lipid membranes, and electroporation will cause small holes in the lipid membrane.
Yep.
And with this, you get better exchange between the two.
Okay.
So that's how then exosomes can go deeper into cells or enter cells more easily.
All right. And then the other one that I was curious about is either erbium or CO2 laser, or even plasma fibroblasting. So, and I asked you earlier, I'm like, plasma fibroblasting, are we actually creating a little hole, so the exosome can go in? Because we're not. We're actually creating an ablation or a coagulation of the tissue. But your answer was?
Every injury will disrupt the cellular barrier in some way, and if there's an injury and the cell membrane or the skin barrier is not intact, then exosomes, because they're very small, they're not small enough to go through healthy tissue, but as soon as there is an injury in some form, they should be able to penetrate through the barrier.
Okay, great. By the way, if you have any questions, feel free just to type them. We'll be able to answer those as well. So with plasma fibroblasting, we said, great, that's fine. Even with erbium or your CO2, because we're creating tiny little, micro thermal zones for that product to enter, or the exosomes to enter. So it's actually great for all of these different modalities. So my next question then is quality. Bioawareness. I mean, this is going to be a really big sort of thing, because, clinicians and beauty therapists and dermal therapists, we all need a bit of clarity. So from a science perspective, are all exosome products created equally?
Not at all. And I think purification and characterization are the most crucial parts of exosome research or exosome products. I think there's a lot of really, I would say, dodgy work out there where people claim these are exosomes, so they purify something which has a similar size, but they don't characterize them fully. And not everything which is 30 to 150 nanometer and looks like an exosome has really the ingredients you need to have your biological effects. There's really a lot of work has gone, especially in medicine, because if you want to inject them into humans as a therapy, there's a very, very high barrier of regulatory approval to make sure that you really have the same ingredients all the time. Batch-to-batch variations are increasingly important in regulatory approval, of course, because these are complex molecules, or complex, not molecules, complex vesicles. It's not that you have an aspirin or a Nurofen, like one molecule which you can clearly define. This is a mixture of a lot of different biomolecules, proteins, RNA, lipids, and regulatory authorities want to see clear batch-to-batch consistency.
Yeah. And the thing is, as clinicians and therapists, like, how do we know? Like, I almost made a mistake, and I was going to distribute a particular, one, and luckily I didn't, because the more research I did, and I don't know who does this much research when they bring in a product from overseas and distributes it, but the more research, the more data I read, I was like, this is not like as effective as they say, and there's not that many exosomes and quality exosomes as they make out to be. So it's good if it's confusing for me. Imagine for the clinician or the therapist, right?
You're a bit at the mercy of the supplier, of course. I think if you have someone who provides a high quality product, it works for your customers, it gives you great results, then of course you're in a good position to continue this. But I would still get characterization from time to time to see that they still have the same size, they have the same morphology, they look the same on their data sheet. I think every product you give to a customer should come with some kind of characterization, because in the end it's a biological treatment, and you want to have consistency. Because if you then suddenly don't get the results you got before, you have no explanation why your results are changing. So I think to have this evidence in writing, what's the size, what's the size distribution, how do they look like in microscopy, is important. I know it might be a bit too much for someone in the industry, but I think keep an eye on that. I think that's important.
I think that's going to be really important, isn't it? I can see we've got a few questions, and I know we're running a little bit behind, so we'll just sort of finish a few more questions that I had, and then we'll go on to our viewers' questions. So what else should I be asking here? Just to wrap it up, therapists should be asking about vesicle concentration, characterization methods, which is what you said, batch consistency, stability data, whether it's purified exosomes or they're actually conditioned media, how they're stored and handled. So that's a really good checklist for our clinicians and beauty therapists, right?
Yeah.
Okay. So a final really critical question before we get on to other questions from the viewers. The aesthetic industry currently, are they ahead of the science when it comes to exosomes? Are we just actually going on to this hype, and we're on this, like, train that's a million miles an hour? Are we going too fast?
I think definitely. I think it's a very, very young field. If you saw, like, discovered in the 1980s, in the bigger things, it's not a long time since we actually know what exosomes are. The role what exosomes are was just appreciated basically 25 years ago. So it's not a long time in the bigger sort of things. It's still a young field. It's still a field where we can learn a lot. There's still subclasses of exosomes discovered these days. So I think we need to probably slow down a little bit and have quality over quantity. That comes down to what I said about the dose is not always important. You can have a very, very pure exosome preparation, which is very low concentration, but it's highly potent because it's so pure and so well defined, and it gives you amazing results instead of dumping a whole lot of cell fragments and rubbish, so to say, onto someone's skin. And you say, I have how many millions of exosomes, but they're not really have anything in there. So because a lot of exosomes might be completely empty or might be just cell fragments. So we still have to learn a lot in the aesthetics industry, but also in medicine. I think in medicine there's a lot of hype as well on exosomes, and there are a lot of companies spun out. There's a lot of money to be made with spin outs in the exosome field. But do they really deliver, and do they really do the job right? That needs to be seen.
Okay, that's great. And I'll watch this space. I think there's going to be more development, not just on exosomes, but on other interesting and novel ways to treat the skin and inflammation and trauma and so forth, right?
Yeah, I think it has great potential, 100%. I think because they're so potent and so versatile. It's not just one molecule. Yeah, you're giving the skin like complete recipe what to do, and think that's makes exosomes so exciting and so great. But the devil is in the detail as always.
That's it. All right, we've got a question from the Honest Glow. Thank you very much. Is microneedling more efficient for exosome delivery than sonophoresis?
I think needs to be tested. I think if the supplier has a certain method they recommend based on their research, I would go with that. But I think there's not a general rule that one is better than the other. Yeah. It depends potentially also on the exosome preparation, if it's plant derived or if it's mammalian derived, because there are subtle size differences in those. So the mammalian derived, so the human exosomes are usually more on the smaller size, and the plant derived are more on the bigger size. So that determines also what method you use for the delivery.
Right. So we can't really give a precise answer because there's a lot of variables, right? From my understanding. Okay. Doesn't help. I think sometimes when I'm not sure what's better than the other, I'll do half-half. So I might needle, in this instance, I might needle, half by skin, and the other half I'll, infuse with sonophoresis, for example, and see what I think. And, you might do, say, an erbium or some type of laser treatment where there's quite a bit of trauma, and apply exosomes, on half and not the other. So I think doing your own testing is going to be also the best way to work out if something works or not. I mean, that's how I learn, and that's how I also teach. Sam, hello, Sammy. So Sammy's saying spicules. Do you know what spicules are?
I think I saw them, yeah.
All right. Is spicules, is it really effective? So in your opinion, what's the best delivery method? Is this going to keep popping up?
So, yeah, I think if you get good results, they are, as I understand it, they cause some kind of trauma or some kind of injury, but it's very, very mild. But if you see good effects with this method, then it's clearly doing something, and it's maybe destroying the exosomes in some way, or causing some kind of skin irritation or skin injury, which allows the exosomes or the payload, what's inside the exosomes, to go in. Yeah.
Okay. And I think with the spicules, not all spicules are created equal again, right? So that's always going to be a challenging one. Great question. Jenna, so with all the brands bringing out skincare, for example, PDRN, serums, moisturizers for at-home use, do you think these are ineffective as they're not going through via skin trauma?
So I think I mentioned that at the start. So there's physical injury, but that's also chemical enhancers to allow skin penetration. Yeah. So the alcohols, glycerol, there's certain fatty acids or surfactants. So basically, detergents can have the same effect. If you put a detergent on your skin, it will compromise your barrier, and it will also allow payload and exosomes and molecules to go in. But you're causing damage, of course, in the long term if you put detergents on the skin. And we had this discussion recently about during COVID, when we're all washing our hands in alcohol all the time. Our hands look terrible because the skin was completely stripped of lipids and of moisture. And that's a way to get penetration into the skin, but it's not very healthy, especially for home care. Yeah. So have a look what's in these products. Are there any permeation enhancers in there? Then it could work, because then you cause some kind of chemical trauma to the skin.
So what about like an enzyme? If they're doing an enzyme or some kind of a chemical peel or a biomimetic peel?
That could do the job as well. Yeah. So okay. I think an enzyme or urea is a good example. It's a very mild permeation enhancer. Enzymes are a bit more potent because they basically chop away the tissue and the extracellular matrix, depending on what enzymes you're using. Yeah. So if there's anything which gives you an indication that it compromises the barrier, even if it's just temporarily, then that could be a way and could be still effective. No question about it.
So, with just to reiterate, the skincare that does have exosomes potentially could actually be beneficial, even though they're not having needling or some type of aesthetic treatment. The home care will also work to an extent too.
Yeah.
Cool, very good.
Yeah.
I love that. Jenna saying exosome serums, moisturizers. Okay, cool. Yana, hello, Yana. What are your thoughts on exosome skin boosters made by freeze drying technology?
So I'm not 100% sure what you're referring to, but freeze drying is usually a method just to preserve and make them more to preserve the exosome preparation, make them more stable, or store them in a way that they don't have a higher shelf life, basically. Yeah. Do you enhance the uptake potentially, because freeze drying can destroy exosomes and lipid particles, and then you release what's inside. So you have your preparation, you freeze dry it, and then once you reconstitute it, so you add water again to your freeze dried solution, then it could be more potent because they all have their payload or the inside of the exosomes already released to a certain amount.
Yep. So I've got a question for you then. Like for example, Lara Medical, it's a vial, the exosome is already in a liquid form versus a exosome in a jar with a, what is it? They've got a second jar?
Yeah.
What's it called?
Like the solvent or the reconstitution liquid.
So you've got a liquid to basically, you're wetting the exosome. Is one better than the other?
Good question. I think that if you have the right methods to deliver, the intact exosomes is probably a better way to bring that into the skin, because you have the entire vesicle going in, but then you need, of course, barrier disruption, as we discussed.
Yep.
With the freeze drying, you probably have some kind of leakage from your exosomes. So you have a mixture of intact exosomes which are partially broken. So you have the ingredients already in the liquid, which then has a mixed effect. So you probably don't need that much penetration enhancers, but you might not get the full effect. Depends what you're doing. I think for home care or for use in clinic with needling or with some device, I would probably go with the intact liquid exosomes and not with the freeze-dried.
Intact liquid so the exosomes that are already in a liquid form, already pre-mixed.
Pre-mixed, yeah.
Okay,
For clinical application, for home use, you might want to go with freeze-dried because you have a bit more.
No, but clients aren't going to, have a freeze-dried and mix it with their creams, are they?
I don't know. I think that might be something to consider. Yeah, I think.
But then you're saying pre-mixed is better anyway.
It depends what enhancer you're using. I think it's a balance between
like hyaluronic acid.
How compromised is your barrier? Do you relying on intact exosomes to all go in, or you want exosomes and parts of exosomes going in into a less compromised barrier? So hyaluronic acid is a strong enhancer. So you can probably go with intact exosomes to deliver them.
There you go. See, our conversations are awesome. All right, what have we got here? Helpful, thank you very much. Jenna, one more question. With delivery when needling, do you think it's any more beneficial using exosome as a slip when needling or more of an application straight after? Let me give you my take while you think about that.
Yeah.
If we're using hyaluronic acid, that's going into these little tiny channels that we've created, and then you apply exosome afterwards, and the viscosity of the hyaluronic acid is thicker than the viscosity of your exosome. Is that a problem? So
that you don't get mixing?
Mixing's not a problem, but what about like a big molecule versus a little molecule? With a little molecule, the exosome still find its way where it needs to go with the hyaluronic acid in that channel.
the viscosity in the channel is too high for the exosomes to go through.
What do you
Yeah.
think?
Potentially. I think exosomes usually travel through the bloodstream, which has not a very high viscosity, but it's also more viscous than water, as we know. But they also go into the tissue. Yeah? And in the tissue, you have much more constraints between cells for particles to move around, and they're still able to penetrate into tissue to a certain degree. Because they're so small, I don't see that as a major issue. But coming back to the initial point, the earlier the better. If you want to apply it during the needling process, then that's probably the earliest you can get your effects, and you might have better results by going in early.
Oh, that's what I reckon.
Yeah.
I mean, not that I'm saying that like hyaluronic acid will stop the process, that exosome process from occurring. But I think if you're using it as a slip, one, it's as soon as the impact has happened, that wound has happened.
Yeah.
And two, it's the first thing that's going into the skin, and there's no way there's going to be any obstruction by another molecule.
Yeah.
That's my logic brain. Well, it's not.
No, but also in medicine, I think if you think about if you have surgery or something like that, people would put anti-inflammatory on board even before the surgery starts. Yeah, so you would where you do your incision or where you cut someone during a surgery, you put anti-inflammatories locally. You give systemic anti-inflammatory drugs, just to avoid that this massive inflammation you get from this trauma is basically causing too much havoc, basically. Yeah.
Really good questions.
Yeah, very good questions.
Yeah, okay. Terrain, hopefully that's how I say your name. Exosome as an intradermal injectables in scalp versus growth factor concentrate with exosomes where the patient's blood is not used, and growth factors is prepared. GFC, growth factors?
Growth factors, yeah.
Is prepared. Which is better option for scalp, in your opinions? I'm going to throw that over to you.
Yeah, good question. I think one thing people have done, and we have tried as well, and to really drill down what is the active ingredients in exosomes. So if you have a certain exosome preparation, do you actually need everything which is in the exosomes, or you only need 15 or 20 of the ingredients of the hundreds and hundreds of thousands of exosome ingredients? Yeah. If you can have a mixture of factors and they're all replicating what the exosome will do, that would be, of course, a way to go without even using exosomes. But so far, I don't think that we have solved this riddle. So I would say that exosomes are usually the more complete package for anything you do, because at the moment we don't understand enough what specific ingredients in the exosomes are having the biological effect. Yeah, is that everything? Unlikely. Is that 80% of the ingredients are responsible for the biological effect? Probably more likely. And you know that some exosomes are biomimetic, so they're not actual exosomes. They are exosomes ingredients, which are then recombinantly made or sourced from other sources and then packaged into liposomes. And then they are like man-made exosomes, so to say. And some show good results, no question about it. But they're probably missing a little bit of the complete package, because only, I think, nature and the cell can package exosomes in the right way.
No,
so far.
What it needs, right?
Yeah.
But with AI.
Let's exactly. I just was about to say that. AI might come to the rescue and tell us in a few years that we don't need exosomes, we only need this 25 individual RNA species and growth factors and proteins. And if we mix these 25 individual molecules and put them into a lipid nanoparticle, then we have the ultimate nanoparticle and exosome. Yeah.
Yeah, oh, you're welcome. You're welcome, Elena. All right, we've gone way over time, but this has been so riveting. I love this information. I hope you did too. If you want more information, there is another place you can go to. And this is the whole reason why we launched our podcast together. And it's called The Science Behind Aesthetics, because regenerative, again that word, terminology needs biological context. On the podcast, we go deeper into inflammation, biomaterials, cellular signaling, what else?
Melasma, acne. We go into everything which is important in skincare and in aesthetics.
Yeah.
And really, from a scientific point of view, we drill down on the facts and the scientific evidence. What is the published literature saying, and what are the claims which are out there?
All right, so we're going to drop that link below, or you can just go to Spotify, or is it on Apple Play or whatever?
Soon, I think. Yeah.
Anyway, Spotify, you'll find us, The Science Behind Aesthetics. But for now, this Sunday and Monday, I'm going to be exhibiting and talking to so many different people at Inside Industry in Footscray. It's actually a free event by Tamara Reed. So make sure you hop on to her Instagram and have a look. It is a small, intimate gathering focused on connection and education without the sales pressure. No expo chaos, no hard selling, just meaningful discussion and learning. So if you're craving depth instead of noise, I'm going to pop that link below. You do need to register, even though it is a free webinar. But next Tuesday night at 8 p.m, join me. I'm going to be discussing the BB Glow and why it's so amazing. Or is it?
We'll find out.
All right, everyone. Thank you so much. And I'll see you next Tuesday night, 8 p.m. Have a good night.
Thank you.
Bye.
Thank you.
That was great.
Oh.